Hello, everyone. Welcome to our Monday Moving with MS virtual support group. I am Dr. Gretchen Hawley, physical therapist and MS certified specialist. Hopefully, you have joined us before and you know who I am. But if you don't, this is something that I co-host along with MS Views and News every month. And there's a different topic each month based on physical therapy and tangible things that you can do to improve symptoms that you might be struggling with your MS and feel more hopeful, feel more empowered, more confident, more independent. So today's topic this month is about neuroplasticity and MS-specific physical therapy. And for all of you guys who are on live, let me see who's joining. I see everyone. For all of you guys on live or watching the recording, in my mind, this specific topic that we're covering today covers the basics, the foundation. Like, this is what you need to know before you do anything else. It's really the foundation of how and why it's possible to improve your strength, your balance, your walking, etc., even with a progressive and chronic illness like multiple sclerosis. So, and as I mentioned in the very beginning, I'm Dr. Gretchen Hawley, physical therapist and MS specialist. I partner with MS Views and News for our monthly Moving with MS support group. And a huge, huge, huge thank you to our supporting sponsor, Viatris. Awesome. Okay. So again, our topic today is neuroplasticity and MS-specific exercise. So we're going to talk about a lot of different things, starting with neuroplasticity and then diving into MS-specific physical therapy. I am so passionate about this because knowing what MS-specific physical therapy is and what neuroplasticity is and techniques that you can use to help know if you're doing the right exercises can truly make or break an exercise routine. If you have ever said to yourself or thought to yourself, I'm getting stronger, but walking is not any easier, or I'm getting stronger, but stairs is still super challenging. I'm getting better balance, but XYZ is still challenging. Like, something's improving, but your function, your activities are not getting any easier. You're probably not doing MS-specific physical therapy. Similarly, if you've ever said, I'm just not getting stronger, I'm just not improving, I've been exercising for a long time and I'm just not improving, you're probably not strengthening in a way that promotes neuroplasticity. So again, as I mentioned, this is the ground foundational stuff that you got to know in order to move forward. So first up is neuroplasticity. What is it? If you know what neuroplasticity is and you know it well enough where you could explain it to someone, type yes in the chat. If you know what it is, but you couldn't explain it to someone, or if you've never heard of it before, type no. I'm just curious to see who we have tuning in today, because I talk about neuroplasticity a lot. So hopefully if you followed me or if you've joined some of our webinars and support groups before, you're aware of it, but I'm just curious where you guys are. So I see a bunch of people saying yes. Oops, didn't mean to do that. Oh my gosh, there we go. Okay, several people saying no, several people saying yes. Lori's saying, I generally understand. I know what it is from you. I understand the basics, somewhat retraining. Yeah, so it's really important to understand what neuroplasticity is. And in my opinion, it's important to understand what it is so well that you could then explain it to someone else. Because if you don't understand it at that level, you might not understand it at the level that's required to keep you consistent and to keep you resilient even during those hard days. So that's why I like to ask that question of if you know what it is and could explain it to someone else. Okay, so here's a good recap if you don't know what it is or if you want a reminder. Neuroplasticity is the ability of our brain, excuse me, to change our neural pathways, to change function and to strengthen our current neural pathways. So there's two ways that it can work, and it's dependent on what your current neural pathways are like. As we know, with MS, neural pathways, your neurons, and axons can be demyelinated. So when you have demyelination from MS, one of two things can happen. One, you can still use those axons and those neural pathways. There's just a little bit harder. Movement is more challenging, but you can still move. In that case, what you're likely doing when you're exercising is type 1 structural plasticity. So structural plasticity is the ability of your brain to adapt and strengthen the neural pathways that you already have through experiences, memories, so by practicing things over and over again. So again, if you have movement, if you're able to do things, it's just more challenging because of MS, you likely are doing structural plasticity because your brain is going to strengthen your neural pathways that are already working. If you don't have movement in a specific muscle group, for example, if I were to say lift your leg or lift your ankle and nothing happens, that means that that neural pathway, that specific neural pathway, is so demyelinated that it's not going to get stronger. But the good news for you is that you're likely going to have functional plasticity, which is the brain's ability to rewire itself. It's not going to just keep strengthening that same wired neural pathway that's damaged because it's not working at all. So neuroplasticity is the ability for your brain to go around the damaged area, around the demyelinated area, and find a new neural pathway, which is amazing. It is the whole reason that people with MS, regardless of where you're at now, can actually improve your strength, your walking and balance, regardless of if you have no movement in certain muscles right now. Of course, that's going to take longer, but it's possible. Or if you have some movement or okay movement, it's just more challenging because of the demyelination. So let me also finish this slide by saying that it is possible to have both. All of us can have structural plasticity and functional plasticity, where we're constantly learning new things. Like, these things happen not just for exercise. We're talking about it for exercise today, but this happens when learning a new language. When we have experiences or memories of learning a language, we're going to start to retain that. We're going to create neural pathways and strengthen neural pathways for that language. And if it's a brand new language, we're going to be doing functional plasticity, where we're going to find a new way, excuse me, for those neural pathways to be formed. We see this a lot in babies as well. So that's what neuroplasticity is, and it's so important because it works in different ways dependent on where you are currently at. I see people saying that they understand. Awesome. So there's one question. Can you talk about lion's mane supplement to support growth of our neurons? I don't know a whole lot about lion's mane. It's also a slightly different topic. In general, it's more of like the supplement topic, but I will say that I went to the annual MS conference this past May, just a few months ago, and I specifically went to a lecture that talked about all new updates in the world of supplements and nutrition and diet, and lion's mane was mentioned, but not in a way where they were really promoting it or that it works better than something else. It really wasn't a main thing that they discussed. So I'm assuming that the reason for that is that they're looking for more evidence-based research on that. Getting the nerves to reroute or take a detour around what MS has buggered up. Yes, absolutely. Does neuroplasticity occur with repetitive motion, or does it require more? So we're going to go into exactly what it requires to get neuroplasticity to happen. Before we get to that, I just want to go a little bit further and explain BDNF. So BDNF is the brain-derived neurotropic factor. And the reason I like to talk about this is because it is a protein that is in all of us, and it is released when we exercise. And the reason that this is important, it's not just like an endorphin or something like that. But this specific protein supports the survival of existing neurons and neural pathways, and it encourages growth of new neurons and neural pathways. So if you're thinking about neuroplasticity, we just mentioned that neuroplasticity works in both ways, two different ways. BDNF supports both of those ways. And not only that, it also can help alleviate depression and anxiety and have cognitive improvement as well. And the beauty of BDNF is that research shows that in order to exercise enough to get this protein released so that your brain is supporting these neural pathways, whether it's current or new ones, is 20 minutes of exercise. That's all you need. I love when this research came out because so many people at the time, this was several years ago now, but so many people at the time were still in the mindset of, if I can't exercise for an hour, it's not worth it. Or if I can't exercise for 45 minutes, it's not worth it. And that's not true at all. 20 minutes is what research shows is enough to release BDNF. And not only that, low to moderate intensity level is enough to release it. Again, I love when that came out because at the time I was working with a lot of patients who felt that their level of exercise was low or moderate, and therefore it's not going to do anything. You know, they were used to doing high intensity or moderate to high intensity. And so to them, this low or low to moderate didn't feel like much. And so they thought it wouldn't do anything, but it does. It releases this protein. And MRI evidence shows neuroplasticity to be true as well. So there's lots of studies, but one in particular that I like to reference is this one, which is there were two different groups of people in the study, all had MS, and one group remained physically fit and the other group did not exercise at all. And across the board in all of these studies, but this one in particular, the group that stayed physically fit had less deterioration in the brain, and they were able to see this through MRIs. They had less deterioration in the brain. They had improved recovery after they did have a relapse or an attack for those that had relapsing MS, and they had reduced long-term disability. And so there were actual changes in the brain for those that stayed physically fit, for those that exercised. So I think it's important to visualize that too. Exercise is not just about feeling different or improving walking. Of course, those things are great, but it's actually making a difference in your brain too. Okay, so here's the real question. How do you activate neuroplasticity? So we know that it exists, but what do we do? And this slide is going to be really important. I'm actually going to share this slide later in the presentation with you as well, because it goes along with another slide, and it's one of the most important slides that I'm going to review with you today. So the first thing that you need to know to get neuroplasticity working is to do cardio exercises before strengthening exercises. Research shows that doing aerobic-based exercise prior to your functional exercises, and we'll get into what that is, it primes your brain for neuroplasticity. So not only is neuroplasticity possible, but you're more likely to get it to work if you do aerobic exercise first. And I like to personally do aerobic exercise with my upper body, because you might be thinking right now, well, if I do aerobic exercise before my strengthening, my legs are going to be shot. I'm not going to be able to do much because my legs will be so tired. Well, then don't use your legs for aerobic exercise. There's so many aerobic exercises that you can do using your upper body. So that's how I always suggest to my patients, to my Missing Link members, one-on-one clients, you name it, everyone, I suggest upper body cardio. Next up is focused attention. So when you're doing an exercise, having focused attention on that specific exercise can promote neuroplasticity. And what that means is if you're practicing marching, if you're practicing balance or stair climbing or whatever it is, if you're also thinking about what you're going to have for dinner, what you're going to wear the next day, when you're going to shower, who you're going to see later that day, what errands do you need to do. If you're thinking about other things, you're less likely to promote neuroplasticity. So that focused attention, as boring as it might be at times, focused attention is important. Next is alertness. And so similarly to focused attention, but slightly different, if you're just really drowsy, groggy, you're just not really alert, you're doing it just to do it, it's better than nothing. You should still exercise, you should still move, but you're more likely to promote neuroplasticity if you are alert. And so it's really important that you're timing your exercises that you do at a time when you are most alert. And if you're going in person to physical therapy, go at a time that you're most alert. So often people would come after the workday, and you're probably really tired after your workday. It's the last thing that you're going to do. Then you have to go home, you have to make dinner, and usually you're not as alert then as you might be in the morning. Or for some people, morning is the worst, but they're best at night or in the afternoon. So time it to exercise when you are alert. Next up is urgency. And one way I like to think of urgency is challenge. And if you're in the missing link, you know my favorite way to get urgency or challenge is to use the Bop It. So let me know in the chat if you guys know what the Bop It is. The Bop It is a kid's toy, and it has something that you can spin, bop, pull, twist, and flick. And this toy tells you what to do. There's a voice that comes through, it tells you what to do, and you have to do what it says. And not only that, but there's background music, and the better you do, the quicker it goes. And it creates a lot of urgency, and it creates a lot of alertness and focused attention on that specific activity. And so it's really challenging, but I really like it for challenge and urgency. One thing that I'll mention now is that any of these things, from focused attention down to salience, any of these things can be done as your exercise or between your exercises. So if you happen to be feeling really groggy one day, fatigue is getting the best of you, still exercise, but between your exercises, do something that makes you feel alert. Or, do an exercise, but then during your rest break, you're doing the Bop It instead of making that challenge or urgency part of the exercise itself. Both are fine ways to go about it. If you wanted to create more urgency or more challenge with an exercise, balance is a great way to do that. If you have anything that you can stand on to make balance a little bit more challenging, that's a really great way to create that challenge and urgency. Next up is novelty, so trying new things. One way that I like to promote this with my clients is classes. And so if you're always doing the same routine over and over and over again, that's not as likely going to promote neuroplasticity. And it could be as simple as doing the same exercises, but in a different order. Don't always do them 1 through 5 in the same order. Maybe start with 5 and then 3 and then 4, then 2, then 1 day. Just switch things up, make things new. Or get yourself in a different environment. Maybe instead of exercising in the same room that you always exercise in, you go to a different room. Or maybe you're doing a completely new exercise or a new position. Instead of sitting, you're going to be standing, or vice versa. So novelty. And then lastly is salience. And this one's important because what salience means is it needs to mean something to you, which is why in these Moving with MS support groups and everywhere that I teach, I try to explain the why behind everything. Because if you don't understand why a specific exercise is important, it's not going to mean anything to you. And if it doesn't mean anything to you, you're probably not going to stay consistent at it. For example, one of my favorite exercises that you likely are aware of, because I teach it quite often, is marching. So this is a marching exercise, and you can recline too. Now, if this is your first time hearing of marching, and you don't know why I'm having you do it, it might seem boring and like you're not going to stick to this. But what if I told you that if you're sitting in a car and you need to get out of the car, you need to be able to do this exact movement. You need to be able to lift your leg and move it out, and then lift this leg and move it out. you might be more likely to actually prioritize that exercise if getting out of the car is something that's challenging for you. Similarly, what if I told you that this exercise is a different variation of this exercise? And in order to walk or climb stairs or take a step forward, you need to be able to march. So that exercise, this one right here, is going to help you walk. And so understanding why an exercise is important is really important to help you stay consistent, and it promotes neuroplasticity. And I always suggest taking it a step further. So instead of just thinking of marching will help me with improve my walking, what specific situations do you want to walk in? Just to give you a few examples, I've had patients tell me that they want to walk so that they can take their son trick-or-treating. So now you can associate, if I do this marching exercise, it's going to help me go trick-or-treating with my son. That's meaningful. Or a few of my patients, they want to improve their walking so that they can walk their child down, well, adult child, down the aisle at their wedding. That's meaningful. So salience, creating something, an association that means something. Let me look in the chat. I see some comments and questions. Is it 20 minutes all at once or split up? So according to the research that I have seen, it's 20 minutes all at once. However, there is MS research showing that exercising throughout the day is just as effective as exercising all at once. Thank you for reminding of this, of course. How long should we do cardio? So there's no guidelines right now of how long the cardio should be, or of how many minutes cardio should be, or how intense it should be, or anything like that. We just know that cardio before MS-specific exercises is beneficial. And so typically the number that I've been shooting for with whenever I do cardio exercise with my patients is 3 cardio exercises for about 1 minute each. So about 3 minutes. It usually ends up being about 4 minutes because we take a little bit of a break between each one. But 3 to 5 minutes is usually what I recommend. A few people asking that question. How do I do the upper body cardio beforehand if I have optic neuritis and it flares with elevated body temperature? So body temperature is when a symptom worsens due to increased body temperature, that is heat intolerance. Heat intolerance can worsen any symptom if your core temperature rises by at least 1/2 degree. And we've had a few other webinars where we talk more about heat intolerance, so definitely check the recordings for those. But what I will say is cool yourself down proactively. So sip ice cold water before you even start exercising and during your exercise and after. Wear a cooling vest, wear a cooling hat, cool yourself down before, during, and after. How much time is sufficient? Okay, yep, same question. You don't know the BOPIT. Okay, so a bunch of people saying no, they don't know it. I didn't know what it was until, honestly, like maybe 2 or 3 months ago before I purchased it. I have, but I stink at it. Yeah, it's really hard. Can you show a picture of the BOPIT? Yeah, let me pull it up for you guys. I got mine on Amazon. So this is the one that I'm talking about. It's really challenging. I actually just purchased this one as well. I haven't played with it yet, so you haven't seen me talk about it anywhere. This is the version that I was talking about earlier. And this is where you flick, you spin, pull, and twist. So it's really challenging. But this one, you just twist and pull. So again, I purchased this one. I need to play with it. This one I imagine would be easier. So if you're really struggling with this one, you could always try that one. Looks like that's the overall pick anyways from Amazon. So that's the BOPIT. If we have disease breakthrough, could that indicate that our exercise activity isn't sufficient or adequate? Yeah, that is a tough question. I would say no. Disease breakthrough, so how do I phrase this? Exercise is geared towards slowing the progression of MS, but if you have a disease breakthrough, that's not an indicator that your exercises aren't working. Disease progression can often happen regardless of what your exercise routine is, but exercise can slow it down. So it doesn't mean that you're not doing the right things. Sometimes it happens either way. I always like to picture two versions of yourself. One as someone who never exercised, and then one as someone who does exercise. And this would be impossible to do, but if you do have a disease progression, even though you've been exercising, trying to think, but what would I be like? How would this flare be or this progression be if I hadn't been exercising for 10 years? And more often than not, you would think, yeah, this would be different. That may have happened so much sooner, or it may have been much worse off. Papa was in an episode of the Gilmore Girls. That's funny. My house is at a low temperature. Absolutely. Yeah, I've been dealing with heat intolerance for many years. So someone asking about drop foot, we're not even halfway through the webinar right now, and I still have so much more to talk about. So I'm going to hold that question. We have had other webinars where we do talk about drop foot, and was it last month or 2 months ago, the topic was tools that can help with mobility, and we talk about electrical stimulation and AFO, so definitely check the recording for that one. All right, so a few neuroplasticity FAQs that I hear frequently. How long does it take? There's no way to know. It does take less time if you are someone where it's strengthening your current neural pathways. So if you are someone where I say lift your ankle, bend your knee, lift your leg, do a movement, and you have the movement, it's just limited. In that version, you're going to strengthen the neural pathway that's already there. That you'll see improvements in quicker than if I were to say bend your knee, lift your leg, lift your toes, and there's no movement. With that said, I've given functional MS specific exercises to every client that I work with. And some clients literally within one day will say, whoa, my ankle's lifting better. Now, in that case, that is not neuroplasticity. In that case, it's, as much as I would love to say it is and that I'm a miracle worker, that's not the case. When that happens, it's more so that you had the neural pathways there, you just weren't utilizing it because your body was overcompensating with different muscles, and that made the movement easier. So simply by doing specific exercises, which we're about to get into, you reignited that neural pathway. So it can be as quick as a few days. For most people that have neural pathways already there, you're just strengthening them, you'll probably start to notice those improvements within 2 to 6 months. If you are someone where you don't have the strength to begin with, that can take anywhere up to 2 years. And that's the type, because it takes longer, it really takes consistency and resilience. Does it matter how old I am? No. There is research that shows that the older we get, the longer it might take, but neuroplasticity still happens. Does it matter how long I've had MS? No. But again, if you are starting off at a point where your MS has limited certain muscle groups where there's no movement, those are going to take longer to improve than your other muscle groups where you do have some movement. Because let me also point out, in case it wasn't clear, every muscle has its own neural pathway. And so it's very possible that for lots of muscles that you have, you're just strengthening neural pathways that already work. But for some muscles, you're strengthening by finding a new neural pathway because it's not working at all. So it's not like if you have one muscle that doesn't work, none of them do. Oftentimes it's a mix. And then lastly, does it matter what type of MS I have? No, it does not. There's research showing that neuroplasticity occurs in everyone with MS, regardless of how long you've had it, regardless of your type of MS, regardless of how old you are. It might just take longer with some of those. Okay, so what type of PT? So you know what neuroplasticity is. So we're kind of switching gears now to what type of exercise, what type of PT should you be doing to promote neuroplasticity? And the answer is the exercises or physical therapy that focus on strengthening your neural pathways in addition to your muscles. And that's a huge difference between non-MS specific physical therapy and MS-specific PT is that you have to focus on strengthening the neural pathways. And I have a picture for you. This is one of my favorite pictures that I've made. Here we go. So what needs to happen for a muscle to move? If you are doing orthopedic physical therapy or just general exercises or personal training that's not focused on specific muscle groups, you're focusing on strengthening your muscles, which is this image of the Hulk that I have here. When you have MS, it's not a muscular issue. It feels like it's a muscular issue because your muscles are weaker, your muscles aren't moving. But the reason your muscles are weaker and the reason your muscles aren't moving as much is because the neural pathway is being demyelinated. The neural pathway is where the issue is. So you can work on general muscle strengthening all you want, but more likely than not, it's not going to make a difference, or at least not a lasting difference, because that's not where the issue is. For anyone to improve strength and mobility, what needs to happen is first, our brain needs to either have the thought of, let me lift my leg, or it needs to be a reflex. But your brain needs to do the work first. So you think, let me lift my leg, or let me take that step forward. Then it doesn't just skip right to the Hulk. It doesn't just skip right to the muscles. Before it even gets to the muscles, that message, that thought needs to travel down, who knows, trillions of neural pathways starting at your brain, going all the way down to the muscles responsible for lifting your leg. But those neural pathways are part of the process. And in MS, that's where the issue is. So when you're thinking about what exercises you need to be able to do, it needs to be focused on strengthening the neural pathway first and foremost. I'll tell you how to do that. And then that's when you'll notice the muscles actually starting to improve and function starting to improve as well. I see Debbie says yes. Okay. So these next few slides I'm going to go somewhat quicker through because there's slides at the end that I really want to make sure we get to. But what type of PT or physical therapy focuses on those neural pathways? There's two. One is what I am, which is a multiple sclerosis certified specialist. You might hear this person call themselves, like I do, an MS specialized physical therapist, but the letters after our names, after our degree, is MSCS. The second is a neurological physical therapist or a neurological certified specialist. So NCS is what you will see. Those are the two types of therapists that will focus on strengthening those neural pathways using specific techniques. Now, I do just want to point out, every now and then, you will find an orthopedic. Orthopedic physical therapy is just your typical place that you would go if you have back pain, knee pain, post-op after surgery, neck pain, you name it, shoulder, elbow, anything. So every now and then you'll find an orthopedic PT that does know MS. It's very rare, but because that is one of the possibilities, you can call your orthopedic PT clinics near you and say, hey, do you have anyone that knows MS, or do you have anyone that's certified in MS, and see if they are able to help you. Hopefully I don't need to explain why physical therapy is beneficial, but you never know. Physical therapy can help with so many things. So many people think it's just strength, balance, and walking, or, pain or stretching, something like that. But it can help with so many things, and it is so beneficial when you have MS because, as you know, every day can be different. Every symptom that you have can be varying levels of severity, and it's so important to have someone that can brainstorm with you what you can do on the good days and the bad days. And so physical therapy can help with, of course, strength and balance, but also aerobic endurance, spasticity and muscle tightness, fatigue, depression, walking, quality of life, and so many more things. But these are the main ones that I like to hit on. So general physical therapy, I also sometimes call this traditional physical therapy or orthopedic PT. Again, these are the guys that you'd go to for regular pain, aches, post-op. The requirements is 6 to 7 years of schooling, or a doctorate degree. Doctorate degree is newer within the last 10 to 12 years. Oh my gosh. I've been a PT for 10 years. So it's longer than that. wow, I just got a smack of how long ago that was. So probably, I don't know, 15 to 18 years, I'd say. Wow, that makes me feel old. Anyways, so that is somewhat newer. So it's very likely if you go to an orthopedic PT, they might not have their doctor degree, but that's fine. And they need to pass the National Physical Therapy exam. Their focus is general strengthening, general balance and walking, pain reduction. They often will push you to the point of fatigue. If you picture that image that I just showed you of brain, neuron, Hulk, they focus on the Hulk. They focus on getting your muscles stronger, which sounds like a good thing. But as you know, when you have MS, you need that neural component. Example, so if you're not sure if you've been doing regular exercises or regular PT, classic examples are straight leg raise, side lying leg raise, clamshell squats, bridging, lunges. Let me know in the comments, in the chat box, if you've done any of these before. They're not bad exercises. They are good exercises. But the reason that it's important to know that these are more generic, traditional, general exercises is because when you have MS, your brain and spinal cord does not have the same carryover as someone without MS. I do not have MS, meaning if I do straight leg raise, which is an exercise to strengthen your hip flexors, and then I go to stand up and use my hip flexors, it'll work just fine. But if you have MS, you could get full strength. This exercise, you're lying on your back and it's for your hip flexors. You could get full strength in your hip flexors here, but you go to stand up and walk, you need to use your hip flexors when you walk, and they're just not working at all, even though you had full strength when you're lying down. So a bunch of you guys are saying, I've done all of them. Yes, I've done all of them. Yes, sometimes they cause a flare-up. Yeah, and so if you've ever done them and you felt, why isn't my walking any better? It's because when you have MS, you don't have that carryover. But I'll share with you what you should be doing. This has been my PT in the past. Yeah, so everyone so far is saying, yes, they've done all of these. It's discouraging because I will always have access only to general PT. Mine does have a doctor more sports related. So if you don't, I have a slide at the end of how you can find an I almost said pelvic floor, an MS specialized physical therapist. But at the end of the day, if everything that I share with you isn't accessible to you, follow my YouTube channel, follow my Instagram page, follow my podcast. I have so many free resources where I'm educating on this stuff, but it's going to be up to you to actually implement it. So that's the tricky part if you don't have someone in person that you can work with. Dr. Gretchen, what were the exercises that had the wheels up to help your arm? Did I mention that today? I'm not exactly sure what you're referring to. What about a physiotherapist? Great question. Physiotherapist, generally speaking, is a different name for a physical therapist. So in the United States, we're called physical therapists. If we are in any other country, it's called physiotherapist. So it's the same thing, but so this would be a general physiotherapist instead of general physical therapist. So physiotherapists can get trained to be a neuro certified specialist, and they can get trained to be an MS certified specialist. So just different terminology between the different countries. Okay, how are we doing on time here? Okay, so MS specific PT, requirements, 6 to 7 years of schooling, pass the boards, and then pass the certification, which, without getting too much into it, it requires a lot of observation hours, a lot of treatment hours, making sure that you're putting the knowledge that you're learning into practice and implementing it. You have to pass an exam that's 5 hours long. After that, every 5 years, you either need to retake the exam or submit all of the continuing education that you've done, which I love that they do this, because you need to prove that you're doing the work to stay on top of research. And so every 5 years, you need to prove that you're staying on top of that by having at least 75 hours of continuing education. Now, the focus is functional strengthening, which we're about to get into, specific muscle strengthening. This is really important because if you're focusing on just general movements like squats, squats is a good exercise, but with squats, you're using a lot of muscles all at once. Same with walking, like a regular general PT might just have you practice walking, but when you're walking, you're using the muscles that are already strong, not the muscles that are weaker. And the problem with that is that if you're using only the muscles that are strong, then when those muscles fatigue, and it will happen to all of us, you have no backup supply of strength. And so when that happens, you're kind of screwed. You know, you're fatigued and you're not going to be able to move. But if you focus on the specific muscles that are causing weakness, you'll have that backup supply of strength and you'll be able to move better and longer. The downside is that having backup supply of strength and focusing on specific muscles that are weak, if you've worked with me, you know this, it can be really discouraging because I am asking you to do exercises for the muscles that are weakest, meaning for you, it's going to be the hardest. It's going to be really hard for you to do them. But it's so important. Balance and walking is another primary focus, of course, neuroplasticity, and then neuro recovery and compensation, because as we were talking earlier about neuroplasticity, it can take a while. Neuroplasticity and neuro recovery are both the idea of waiting for your muscles to catch up, to create those neural pathways and get stronger. That can take a while, in some cases, as I mentioned, up to 2 or so years. So in the meantime, it's also important to have compensation strategies, whether that's with a tool or using different muscle strength that you do have. So we focus on those as well. Lastly, it's so important to focus on fatigue. Ask you about your fatigue. As someone mentioned earlier, ask you about heat intolerance, ask you about your sensation in your feet, the vision. Someone earlier mentioned vision. It's so important to ask about these things because it will change the treatment plan. And oftentimes general PTs don't focus on those things. Let me look. Oops. So I'm just going to look in the chat quickly. So this would be when I saw your thought, holding up slides. I'm sorry, Lynn, I don't know what you're referring to. Is it okay to do exercise classes? Yeah, absolutely. So actually in my book, there's chapter, I think it's chapter 4. I talk about all the different types of exercises, and one type is classes. And so Gretchen, great name, is asking, is it okay to do classes like Pilates, yoga, etc.? Yes, if you're also doing these specific functional exercises. You should never just do one type of exercise. And it's tricky because classes might make you think, oh, I'm hitting all the muscle groups. But with classes, you're more likely than not focusing on just the muscles that are already strong. So yes, you can do them in addition to these specific functional exercises. Anywhere from Amazon. I can share, I have an Amazon affiliate link where I have like all my favorite helpful tools. So I can share that with you guys. And Lynn, maybe what you're looking for is in there. Thank you for the reminder on heat intolerance with doing PT. Yeah, absolutely. Okay, so functional exercise. I'm just going to skip ahead to this slide. So functional exercise means taking an activity that you have a difficult time doing and breaking it down into exercise. So I'm going to stop sharing my screen for a second. And I'm a visual learner, so I want to demonstrate this for you guys. So I'm going to demonstrate walking. Let me know, say yes in the chat if you're looking to improve your walking. Most of my clients are, which is why I like to use this as an example, but this is also true if you are, other examples could be if you're trying to improve getting in and out of a car, standing up from a low surface, climbing stairs. With any goal that you have, you want to break it down into different movements. So each movement is its own exercise. So therefore, if we want to improve walking, it's not just walking, it's lots of different movements. Okay, good. A lot of people saying yes, I use a walker. Great. What I'm about to say is true whether you use a mobility aid or not. So get my chair out of the way. So when you're walking, this is what needs to happen. There's 7 things. So if I'm moving forward, I want you to watch this leg. What needs to happen in order for me to take a step forward is first, I need to be able to shift my weight forward. Then I need to be able to bend my knee. Then swoop my toes. 4 is bring my knee up. 5 is straighten my knee. 6 is put my heel down. Don't lose your balance. All while that was happening, I was standing on one leg. I'll repeat that one more time. You guys get the recording to this, so if you need it again, please watch the recording. But these are the 7 steps. Number 1, shift your weight forward. Number 2 is bend your knee. Number 3 is toes up. 4 is knee up. 5 is straighten the knee. 6 is heel down. 7 is you are standing on one leg. Even if you're using a mobility aid, you still have to stand on one leg as your other leg is coming forward. You don't need to have as much movement as I was just demonstrating, but you need to have each of those movements. Now, what functional exercise means is we took our goal of improving walking, and we just broke it down into 7 different movements. Now, each of those 7 movements can be an exercise. So if we think back to number one was shifting your weight forward. So weight shifting, practicing moving your weight forward and back, is a fantastic exercise. It's a functional exercise that will directly help you improve your walking. Number 2 is bending your knee. So you can practice this seated, you can practice it lying down or standing, holding on to something for sure, but practice bending your knee. So you would do that with each of those 7 movements. That's how you would make them into exercises. Okay. I think we're going to make it. We've got 6 minutes left and 3 slides. And the next 2 slides are the 2 most important slides, I think. So feel free to take a picture, watch the recording, take notes. You do what you got to do. I see a bunch of people saying, yes, they are working on walking. Most definitely. There's a question about a bike. I want to come back and answer that one. You are a blessing for someone not having MS. You understand so well. Oh, thank you. Walking is number 1 for me. Yeah. Am I a Giants or a Jets? I'm a Bills fan, and the Bills play tonight at 8. All right. So this slide and then the next slide are the most important slides, I think, because it's the how-to. You now know the background information. Now this is going to teach you exactly how to implement this and what to do. So newest guidelines of how to make sure you're doing the best and most effective exercises for you is that with your exercises, so think about our functional exercises that we just talked about. If you are looking to improve your walking, you now have 7 exercises that you can do. If they're too challenging to do standing, change positions. You can do them lying down, as I mentioned, sitting, recline. You can choose a different position to do it in, but still, it's 7 different exercises. So that's actually the second bullet point here is make sure that your exercises are functional. First bullet point is the neuroplasticity guidelines that we've already reviewed. I also put them on the next slide just so you could see them back to back. So make sure that your exercises are focused on neuroplasticity. You want to make sure that your exercises are functional. You want to have almost perfect quality. I used to say perfect quality, but so many people were really hard on themselves saying, well, it's not perfect, so I'm just going to stop. So I changed it to say almost perfect quality with your exercises. And the reason for that is because our brains remember what we're doing more of. So if you're doing an exercise with poor quality, but you just keep doing it, especially if you're not really paying attention, maybe you're not focused attentive, but you just keep doing it, your brain is going to strengthen that neural pathway because you keep doing it. Whether you want it to remember that neural pathway or not, our brain remembers what we do more of. And so focusing on almost perfect quality means that you're going to strengthen those neural pathways that are the good ones that we want, not the bad ones that can cause you to trip and fall and scuff your foot with foot drop. So when you're doing your exercises, your quality is the number 1 thing, which means high repetitions and rest breaks. So the more repetitions we do, the more likely you are to get those neural pathways working. If you think about it, if you try 5 times to lift your leg, to do that marching exercise in one day, that's 5 times that your brain and spinal cord had the opportunity to find or strengthen a neural pathway. But if you tried 30 times in one day, your brain and spinal cord tried 30 times to strengthen or find a new neural pathway. So the math is easy here. The more you do, the more opportunities for neuroplasticity in strengthening or finding those new neural pathways. But what you might be thinking is what a lot of my clients think, which is, but how can I do 30 and have almost perfect quality? That's where rest breaks come in. Take as many rest breaks as you need. As I mentioned earlier, MS research shows that when you are exercising with these functional exercises, doing them throughout the day is just as effective as doing them all at once. Meaning you can do 5 before breakfast, 5 after breakfast, 5 before lunch, 5 after lunch. How many are we at now? 20. 5 before dinner, 5 after dinner. That's 30. And that's just as effective as doing 10 times 3 sets. So these are the guidelines that you should be thinking of for every exercise that you do. This is the slide I already shared above. I just wanted to put it here so you could see them side by side. These are the neuroplasticity guidelines. And a reminder for this too, because I didn't say it earlier, you don't have to do all of them. Please don't feel like every exercise needs to be focused attention and alert and urgent and novelty and salience. You can pick 1 or 2. It doesn't have to be all of them. We're not striving for perfection here. We're striving for something that's more effective than what you might currently be doing. Okay, this is my last slide. Oh my gosh, we're going to do it. We have 1 minute to spare. So how to get access. So someone earlier was saying, where do I get access? So in-person PT is going to be the best bet, because in person they can, this might sound weird, but they can touch your muscles, they can touch and feel exactly what's happening, they can see you in real time moving in different ways. So the MS Society has a program called the MS Society's Care Partners. So you can look to see if there's any of those in your area. The Consortium of MS Centers also has a resource where you can find MS specialized PTs near you. And then lastly, as I briefly mentioned earlier, call your local PT clinics. Even if they don't have someone with the NCS or MSCS abbreviations after their last name, they might know MS, and that might be your best bet, especially if there's nothing else around you. Telehealth PT could be an option. The only thing about physical therapy is that they have to be licensed in the state that you work with, or in the state that you live in. So I am a licensed PT in Massachusetts, New York, and Maine. So I could treat telehealth with people who live in Massachusetts, New York, and Maine, but I couldn't treat someone in New Jersey or Colorado. So it's a little bit different for neurologists. That's definitely a downside to PTs, but there might be a PT that's in the same state as you, but 5 hours away, and they could work with you via telehealth. So definitely worth looking into. And then the missing link is my online program. It's more educational rather than treatment, whereas the options above are more treatment. But that is an option as well. We did it. We made it to the final slide. This is all the places where you can find me, especially if you are looking for a lot of my free resources. Again, YouTube is my favorite because it's video demonstration. I love learning via video. So my YouTube channel, my podcast, it obviously is more verbal, Instagram, Facebook. The missing link is my online program, but I do offer other things there as well. So that's my website. And let me see if we do have time for questions. I'll stay on for a few minutes longer. If you do have to hop off, thank you so much for joining. But let me just, there was some really good questions that came in. Let me find it. Okay, you've mentioned previously that riding the recumbent bike won't necessarily improve walking, which is correct. The reason for that is because you're sitting down, and when you're walking, you're standing. So often when I'm working with someone who is looking to improve their walking, they'll tell me, I don't know why my walking's not getting better. I'm doing the recumbent bike every day and I'm doing it for 30 minutes and the resistance level is up high and it's just not improving my walking, the most likely reason is because when you're doing a recumbent bicycle, you're sitting down. And when you're walking, you're standing. It's a completely different position. Anyways, the question is, will it help at all? Yeah, so the bike is still a good exercise to do for upper body aerobics, lower body strengthening in a seated position. We still need strength in a seated position. It's going to be great for cardio. So it's good for other things. I just don't want people to think that the bike will help with their walking, because that won't happen. Usually, every now and then someone will say, oh, I did the bike and it helped me improve my walking drastically. Amazing, super, super great. But for most people, that doesn't happen. Lori's a Bills fan too. Awesome. Walking is number one. Standing, yep. Are those balance vibrating boards good for MS? As I mentioned earlier, at the annual MS conference back in May, and one of the lectures that I went to was all about the vibration boards. And they said that they are helpful. You just want to make sure that you look for, there's boards that rotate like this, and then there's boards that go up and down. And based on the research that they were sharing, you want to make sure that you get one that goes up and down. What about hippotherapy for neuroplasticity? I actually haven't heard about hippotherapy specifically for neuroplasticity. Thank you so very much. You're always very helpful. Go Bills. I'm not any Aaron Rodgers fans. Thank you so, so, so much. This is one of my favorite partnerships and collaborations that I do every single month. So thank you to MS Views and News for choosing me as your host, and to Viatris for being our supporter. It means a ton. So thank you to everyone, and I'll see you guys next month. Have a good night, everyone.